Hello and welcome to this special broadcast. I'm 𝗟𝗓𝗓𝗓 and today we are going to discuss on various issues related to sinus. Well, be it summer or winter, sinus is very common among all of us, isn't it? So what is the main cause of sinus? Is sinus a serious problem? Well, to discuss on various sinus-related queries, today I have with me Dr. Bikash Choudhury, ENT specialist from Health City Hospital in the studio. So, Doctor, first of all, welcome to Northeast Live.
Thank you.
So, Doctor, please tell our viewers, well, we all know that sinus is a very common problem. If a person sneezes back to back, then we directly say that, yeah, you are suffering from sinus problem. So, what exactly is sinusitis, Doctor?
Sinuses, first we need to know what are these sinuses. So these sinuses are nothing but hollow empty spaces around our nose. So altogether we have 8 sinuses, 4 on our right side and 4 on our left side. And these are basically lined by the same lining that lines our nose. So one peculiarity about these spaces are they have a very narrow mouth. So the openings are very small and we have an empty space on top. So what is sinusitis now? This sinusitis is inflammation or infection or swelling of the lining of the sinuses. So the sinusitis is the disease and sinus is a normal structure that everyone has.
Right.
So there comes the distinction. So this sinusitis is a very common disease. If you see statistically, around 10 million people in India has at least one episode of sinusitis per year. So that's a very big number. So it's a very common disease. Mostly it can be treated at home. Sometimes they need medical attention. That means to visit a doctor. And if you visit a doctor also, it is not difficult to treat. But if it is ignored or untreated, then it may lead to serious complication in future.
So now, Doctor, if you go into the depths, then, what are the signs or symptoms of sinus? Like, how would a person know about sinusitis?
So, before we discuss about the signs and symptoms, I think we need to know what are the different types of sinusitis that we have. So, these different types of sinusitis, it's in accordance with its duration of symptoms. Like we have, there are 4 varieties. The first one is acute sinusitis, when the symptoms are less than 1 month or 4 weeks. The next variety is subacute sinusitis, where the symptoms are between 4 weeks to 12 weeks. That means within 3 months. Anything beyond 3 months or 12 weeks is the chronic variety of sinusitis. And there is one more type of sinusitis, which is called recurrent sinusitis, where a patient gets at least 4 episodes of sinusitis in 1 year. So these are the different varieties of sinusitis. Next, you asked me about is signs and symptoms.
symptoms.
So again, the signs and symptoms depends on the type of sinuses that are getting involved. So the most common symptoms of sinusitis, as we all know, is the nasal blockage. So nasal blockage is the main symptom. The second common symptom is nasal discharge, like you have watery nose, or we call it running nose. So that watery nose, it can be visible, like it can come outside that secretion, and sometimes it drips back on the backside of your throat, so which we call postnasal drip. So these 2 are the most important symptoms. The first one is nasal blockage, next one is nasal discharge. Then together with that, the patient may have certain pain around the facial region or pressure sensation, which gets worsened when the person bends forward. So this is again a very important symptom. Then the patient may have fever, the patient may have headache, and they may have certain associated symptoms, like they may have ear pain or fullness in the ear or decreased hearing. Sometimes they have tooth pain. Sometimes the patient may have a cough, which is not relieved by the cough medicine. So this is again a very important symptom in case of children. Sometimes the child is coughing and going on coughing, but it is not relief. So it may be a symptom of sinusitis. So these are the main symptoms of sinusitis.
So is sinus a very serious problem? Can it be considered as a very serious?
It is not. Actually,
Okay.
it is not. As I told you, like it is a very, very common problem, and it can be easily treated. So until and unless the complication develops, the sinusitis can be considered as a not so serious problem. Yeah.
Okay. So are there any causes of sinus problems?
Yeah, definitely. Like there are certain causes of sinusitis. As I told you in the beginning, like there is infection of the sinus lining that causes sinusitis.
Okay.
So how the infection occurs? So infection can be caused by virus. So one is a viral cause. So virus infecting the sinus can cause sinusitis, which is usually self-limiting. So the second is like bacterial infection. So bacterial sinusitis, where you need to take antibiotic with doctor's prescription. The third variety, sometimes fungus also can cause sinusitis.
Okay.
So the fungal sinusitis is a little bit a serious issue. So it's not that every person gets sinusitis. There are certain predisposing factor or certain people who are at risk. So who are the people who are at risk? Are the persons who have allergy in nose.
Okay.
Certain people, they sneeze, they have allergy inside the nose, so they are more prone to get sinusitis.
Okay.
The second is like the people having asthma. So they are more prone to get sinusitis. Sometimes some patient may have certain structural problem inside the nose, like the nasal, the bone that divides our nose into two can be bent. So we call deviated nasal septum. So that's one problem. Sometimes they have some swelling inside the nose, we call polyps.
Okay.
So those people are more prone for sinusitis. Another group of persons, like sometimes the body defense system, we call it the immune system, if it is weak. The people having cancer, they are on certain medication, the people having HIV infection, and certain diseases like cystic fibrosis. So this kind of disease, people having this kind of diseases, they are more prone to get sinusitis. Smokers, very important, the active smokers as well as passive smokers, both are very prone to get sinus infections.
Right. So if a person has a sinus problems, then, what are the do's and don'ts, any food or anything that a person need to avoid or need to consume if a person have sinus problem?
I have already mentioned there are certain groups of people who are like at risk of getting recurrent sinusitis. So the do's and don'ts, the do's like food, usually they are not related to sinus infection.
Okay.
So don'ts, we all know the don'ts, like how to prevent sinusitis. Like the first one, like during COVID, we all know, like we have to protect us from the organisms. So hand hygiene is one important thing. Like we need to maintain proper hand hygiene. We need to stay away from people, like social distancing, as we call during COVID. Like if someone is having flu, we have to stay, we have to maintain the distance. Then getting a flu vaccine every year is very important. Then living in a healthy atmosphere, like if we live in a dusty, humid, and where the air quality is poor, if we live in that kind of atmosphere, so we are more prone to get sinusitis. So the don'ts, we know the don'ts, and taking steam inhalation when you get a mild flu, then that is again very, very important.
So being an ENT specialist, what are the tests that you commonly do to diagnose sinusitis?
Most of this acute sinusitis, like any sinusitis which is lasting, say, for 10 days and all, so we don't need to do, actually we don't need to do any test. So it can be diagnosed with taking the patient's proper history and clinical examination by an ENT doctor. Sometimes we, when it's beyond 10 days, so we do a nasal endoscopy. It's a very, very simple procedure. We put a camera inside the nose and we see what is the deformity inside the nose. So it's a very simple procedure. It is done without anesthesia. In case of chronic sinusitis, as I told you, a sinus infection which lasts beyond 30 days.
Okay.
So there, what we sometimes advise some imaging studies like CT scan. So why we do the CT scan? By doing the CT scan, we get to know like what are the structural deformity inside, whether the patient has polyp. So sometimes we advise CT scan. In certain confusing cases or difficult cases, we may subject the patient to do MRI also.
Okay.
So which is not usually like required.
So there are many procedures.
There are many procedures.
All right. So how do you treat the problem?
Say again, treatment of sinusitis, it depends like what type of sinus infection the patient is having.
Okay.
So if it is an acute sinus infection, so the duration of symptom is below 7 days, so he or she may not require to visit a doctor. Certain we call it domiciliary treatment, the treatment at home or self care can help the patient. Like once someone has a nasal blockage or common cold kind of symptoms, though he or she can start doing steam inhalation.
Okay.
So the steam inhalation, how it helps, it moisturizes the nasal cavity, it makes the secretion which become thick, it makes it loose. Then next thing, we can take some nasal drop to clear the nose, which are available over the counter, oxymetazoline drops. If the patient has pain around the sinuses or around the nose, he or she can take paracetamol. So with these measures, most of this sinusitis gets resolved. But if it lasts beyond 7 to 10 days, then it's the time I think the person needs to go and see a doctor. So when he see a doctor, maybe depending on the findings, the doctor may prescribe antibiotic.
Okay.
So one important point I want to highlight here, the patient should not self-medicate.
Yes.
That means like without prescription, the person should not take antibiotic.
Okay.
So injudicious use of antibiotic is very, very harmful. So we keep getting patients, like when they come to us, they tell us that, okay, sir, I have taken azithromycin for 5 days and I'm not getting relief, so that's why I came to you. This is a very, very dangerous thing. Like, please don't self-medicate, don't take antibiotics without prescription, because prescription of antibiotics will depend on so many factors. Antibiotic has good effects at some time, and sometimes it has side effects also.
Okay.
So we have to consider all these things, and then we take the medication. That is about antibiotic in case of bacterial sinusitis. Some chronic sinusitis where there is some structural defect, the patient may need certain surgeries. These surgeries are called endoscopic sinus surgeries, and these days we do these surgeries with the help of endoscope. We don't cut anything outside.
So it's not painful?
It is done under general anesthesia.
Okay.
It is painful, yes, it is not, because it is done under anesthesia, and after operation we give them proper analgesics. So it is done endoscopically, and when it is done endoscopically, you all know we don't cut anything inside, so everything is done through our nostrils only.
Okay. So how is, cold allergy related to sinus?
See, cold allergy is again, as I told you, like the allergy plays the most important role in sinusitis. People who are allergic to anything, it may be cold allergy, it may be dust allergy, it may be allergy to anything like your pollens. So these people are very prone to get sinusitis, and the mechanism is same. This will cause blockage of the sinus openings, it will increase the nasal secretion, and finally all the symptoms of sinusitis will set in. So people having cold allergy, first few days there will be nasal blockage, then the sinuses will get clogged, then he may start having fever, then pain, then it will
So
go
it will
on.
start with
It
cold
will go
allergy, the
on.
first
Yeah,
step. All
yeah.
right. So, now talking about air pollution, as you already
Yes.
mentioned, so how air pollution, causes sinusitis?
Air pollution is a very, very important factor, like in case of sinonasal disease, nose and sinus disease, it plays an important role. So as we know, when the air quality deteriorates, like like recently in Delhi, the air quality was very bad. So that time most of the patients, they got sinusitis. So these pollutants in the air, they act like allergens.
Okay.
Allergens are the agents that causes allergy. The same thing, the same cycle repeats again. It causes allergy inside the nose.
Okay.
Then there will be sinus blockage, there will be secretion, the sinusitis sets in, then there will be infection, and all the symptoms sets in.
Okay. Now talking about the common complications, doctor. Well, what are the common complications that may occur if someone has repeated sinus problems? Repeated sinus problem is very common.
Yes. Repeated sinus infections are very common. Sinusitis is very common, but it's a very treatable condition. So complications are very rare, but they are not uncommon. So the complications can last from can be complications inside the sinus. The sinus may get infected. There may be pus collection there. There will be polyp formation. Then there may be complications outside the sinus. Say sometime, as we know, near the nose we have the eyes. So there may be eye infection, eyeball infection. That can be there. Sometimes there may be the bones around the sinuses may get infected, leading to a condition called osteomyelitis. So these are the main complications, but most of these complications are confined to nose and sinuses.
Right. All right. So viewers, on that note, now it's time for a very short break. Don't go anywhere. Well, right after this break, I'll discuss on how can a person prevent getting repeated sinus infection and can sinus be cured permanently. Today we have with us ENT specialist from Health City Hospital, Dr. Bikash Choudhury in the studio. So I'll be back after this short commercial break. Stay with us. All right, welcome back to this special broadcast. Today, as I already mentioned, today I have with me Dr. Bikash Choudhury, ENT specialist. So we are discussing on various sinus-related issues. So now, doctor, please tell our viewers, like, how can a person prevent getting repeated sinus infection?
Yeah, that's an important question. Like people who are having repeated sinus infection, they have to follow certain protocols. The first thing is like getting a flu vaccine every year, which is very, very important. The second point is avoiding coming in contact with people who are having common cold symptoms.
Okay.
Like we call it social distancing. Hand hygiene, I have already mentioned, is very, very important to maintain the hand hygiene. Staying out of dusty environment, that's again very important, dusty and humid environment. Eating proper nutritional diet, taking proper rest, all these things are important in preventing repeated sinus infections.
Okay. So is sinus contagious? Does it run in families or something like that?
No, sinusitis is not contagious, but the infection causing organism may be contagious.
Okay.
Like a bacteria we know, a virus we know, it spreads from person to person, but sinusitis as such is not contagious. Whether it runs in families, no, it doesn't run in families, but allergy, as we know, allergy has a tendency to run in family, certain types of allergy.
Okay.
So as we said, allergy is an important factor in sinusitis. If allergy is there, then yes, sometimes in one family, like if the allergy runs in the family, so people may have sinusitis problems.
So can a sinus be cured permanently?
It depends on the cause. Like if it is what we call allergic rhinitis leading to sinusitis, if we control the allergy, then maybe yes, we may get permanent relief. But as you know, if we just talk about air pollution, if you're allergic to something in the air, so it's very hard to prevent. Certain sinusitis can be cured permanently, like if, as I mentioned, there is some structural deformity in the nose, say in form of DNS, deviated nasal septum, or if a person has polyp, after surgical operation, that can be there can be a permanent solution.
Can sinus be treated at home? If yes, then how?
Yes, the initial symptoms of sinusitis in case of acute sinusitis can be managed at home. So this is called home-based treatment. So the patient needs to, once the symptoms starts in, the person needs to take steam inhalation, which I'm again telling it's very, very important to take steam inhalation. There are certain nasal drops available, oxymetazoline nasal drop, which is available over the counter to clear the nose. Saline drops can be put. The basic idea is to keep the nose clear.
Okay.
So together with that, if there is pain, we can take paracetamol. So eating a healthy diet, taking proper rest, proper sleep. With that, most of the sinusitis cases can be managed at home.
So, if a person sneezes back to back, if a person has a sinus problem, they sneezes back to back for, many times. So, what is the fastest way to cure it? Any tips on that?
There is nothing like fastest cure. If the patient is sneezing, that means that indirectly it says this is allergic to something. So in these patients, so we use a medicine called antihistaminics like cetirizine, levocetirizine. So at that moment, if he is allergic to something and he is having sneezing, so maybe antihistaminics can help. So after we see the patient, we put the patient under treatment. So we have a laid down protocol to treat these patients. So we put the patient on certain nasal sprays, the corticosteroid nasal sprays. So with that, I think the frequent nasal allergy as well as subsequent sinusitis can be prevented.
Okay. So now talking about dust, if a person is very much exposed to dust, so for any reason, so can dust be a reason for sinus?
Yes, we all know that dust can cause not only sinusitis, it can cause so many other problems also. So in case of sinusitis, dust plays a very, very important role. It is not the street dust what we talk about, it's about the house dust also. So dust as such is an important predisposing factor in sinusitis.
Right. And so doctor, which organ is mostly affected if a person, have a sinus problem?
No, normally it affects the sinuses. As I told you, we have total of 8 sinuses, 4 on the right side, 4 on the left side. If we are talking about sinusitis, then it affects the sinus. It is the sinuses opens into the nose. So initially the nose gets inflamed. So together we got rhinosinusitis. Rhino means nose. Sinusitis means inflammation of the sinuses. So these are the organs that are affected. So if, as we discussed before, that allergy is one of the most important cause of this sinusitis. So long-standing untreated nasal allergy may lead to asthma. Yes. So that is again very important. We tell one airway, one disease. Our airway starts from nose and it ends in the lung. So anything affects the nose, in the long run, it can go and affect the lungs also. So asthma is one thing that, untreated nasal allergy may lead to asthma.
So is regular medication needed?
No, regular medication depends on the cause, what we are targeting, what we are treating.
If a person is having repeated sinus problems,
problem, we try to identify what is the cause of the sinusitis. If it is allergy, yes, we'll treat the allergy, where we need to give certain sprays for a long time, certain tablets for a longer time. It may last for 6 months. So once the patient is cured, once the symptoms disappears, we stop the medication. So yes, if the cause is allergy, then patient needs medication for a long time. If the patient has a structural defect, like he has a deviated nasal septum or a polyp, after operation, he doesn't need medication for a longer time. So the distinction needs to be made there, like what is the underlying cause of this sinusitis. So the whole treatment depends on that.
Yes. Even I know few people, they have undergone an operation, as you've told about the operation, but after undergoing the operation also, they are having now repeated sinus. So what could be the reason for that?
Yes. It again I'm telling, like the underlying factor is allergy.
Okay.
If the allergy is the underlying factor, what we do in the operation, we open up the sinus openings. As I told you, the mouth of the sinus is a very narrow space. So when we operate, we try to open up the sinuses. So while opening up the sinuses, these openings may subsequently, if the allergy persists, if the patient is not on regular medication, if is not coming for reviews as advised by the doctors, it may recur in certain cases, but not always.
So seeing a doctor is very important at that stage.
Yes, very important. Very important to be on a periodic follow-up. Say whenever we call the patient, say sometimes we call every monthly, then every 3 monthly, then 6 monthly and yearly. So after operation, they should come for regular OPD visits.
Okay. So, doctor, now talking about, we were talking about the medication as well. It depends on the causes. So, no, you know, if a person has a cold allergy and he or she is getting repeated sinus, so does the person has to go undergo some test and all to check the allergy levels and then go for medication?
Yes. If we suspect a patient that if she is having allergy of certain types, so we, not always, we do the allergy test at times. So it can be a SPT, with skin prick test, it's called, that we can do. Sometimes we can do some blood test to find out the allergy level. So these are the tests we do, and we try to find out to what the person is allergic to.
So is there any, what is the number, you know, energy level, the dangerous, you know?
Very difficult to say because there are different parameters. In SPT, in skin prick test, the findings are different. If we do a IgE level, that's in the blood, so there the levels are different. So there is a cutoff mark. When it goes beyond that, we suspect something. Then we sometimes we say eosinophil, that's a blood cell. Sometimes we see the eosinophil count also, and we define like if this person, like we have to collectively see all the reports and decide.
So depending on
that.
All right. So, so thank you so much, doctor. So I hope today's episode will be very beneficial for all our viewers as far as sinusitis is concerned. So seeing a doctor is very important when a person is suffering from sinusitis. So thank you so much, Dr. Bikash Choudhury, for joining us this afternoon. And all right, so that's all we have in this special broadcast. Thanks for watching.